So I met this woman with her son one early morning at her lab, looking obviously worried. I was even wondering how they were able to beat the early morning rain because it rained very heavily that morning. Unlike myself that stayed very close to the facility. I could walk in any moment I want. Just seconds, I'm already at the facility. And then that got me thinking about this saying that when someone wants something so badly, he can go to any length to get it. But we got talking, and then going by numerous unrelated questions they were asking me, I could tell they've been reading a lot of stuff online. I wasn't 100% sure, but from my previous experiences, I could guess anyway. Some of them were funny actually, yeah. But one stood out. Why is my son peeing blood? Anyway, it's like one of those things they ask you at gunpoint, and you need to answer your money or your life. And you know, it was almost like a whisper, and yet so loud that it kept ringing in my mind. Even much later, while I was working on the urine sample that the guy brought, there's this worry that comes when we start noticing changes in the color of our urine. I know some people that will be hello, they will just be on the call even while they're peeing, or some other people that will just be doing some other thing, browsing through their phone, just anything, but not the moment you start noticing it change in the color, especially if it's appearing with some symptoms that you are not comfortable with. So you see, just like this woman, anybody can be worried when things like this are happening and could go to any length, desperately sometimes, to know what the cause is. And so I think it's wise today that we talk about what this blood in urine really is, the common causes, and some signs that you shouldn't ignore if you notice it alongside. So stay with us. Let's talk. Please, if you haven't subscribed to our channel, ensure you do that because that's going to ensure that you're not left out on some videos we are going to be dropping ahead, right? Thank you so much. Okay. If you start noticing blood in your urine, it means there's leakage of blood or there's bleeding happening somewhere around your urinary tract. Medical people call it hematuria. It's not a disease in itself, but a symptom of something somewhere happening. It just means something is not all right somewhere, within the urethra, the bladder, the ureters, and the kidneys. Just something. Now, there are ways that this thing happen. There are two major ways that this thing happen, either through mechanical damage or inflammatory damage. But what is actually the cause of this blood in urine? Let's get straight to it. Number one, urinary tract infection. Call it toilet infection, call it whatever you like. All I know is that there's infection there. Right, and this is very common. This is the commonest you can get, especially among ladies, majorly due to the anatomical structure of the urinary tract and some other factors that will play into that. So this is what happens. The bacteria itself, especially this one known as Escherichia coli, usually bore into the walls, the linings, then cause inflammation or break down the tissues around these areas. And then the blood vessels around those places get damaged and then blood will start coming out. And also the body reacts by inflammation. And inflammation, we know, cause leakages of blood because the blood vessels now become more permeable to blood cells and they will start leaking out. And then it will come out, flow out with the urine in different shades of color, majorly brown or brick red, things like that. This is very common within the urethra and the bladder. Although other places can be affected. It's not like we're seeing it's limited to this area. Number two, kidney stone. Okay, I don't mean the stone you used to kill birds or the one that the builder rejected. No, I mean hard deposits from minerals and salts that are formed in the kidney when your urine becomes more concentrated. For some of you who just use a sachet water for the whole day, be warned. And some of you who can just take a glass of water for a whole week, you see what is happening now. Now, how does this thing bring the problem we are looking at? Okay, so when these hard masses are formed, remember they are formed with sharp edges and some blunt edges and stuff like that, and they are hard. So as they are flowing with the urine, they scratch this place, tear out this place, touch this other one, And these touches, these scratches, these scrapings and all that are tearing through and wearing through the linings of your urinary tract and then rupturing things that are capable of bringing out blood. So once it happens, blood will follow if it is damaged enough to expose blood cells. Okay, the smaller ones may not be able to cause much damage, yeah, but the big ones, the big guys in town are the ones that do this stuff. And to show you that this thing is not done with you yet, the smaller ones will now say, okay, so sure, there's power in unity. Let's come together. Now they will combine themselves and form bigger kidney stones. Now, these ones that are bigger will block the passage of urine, and then the urine will come with force, and pressure will increase, and inflammations will happen. You will feel some pains, you will feel some discomfort, you may attract infectious agents, and the whole thing becomes more complex. And then again, as a foreign object in your system, your body notices it and reacts through inflammations. And this one also causes blood to leak out from the vessels and flow down with your urine, and you will begin to see some pink stuff instead of that pale yellow thing. Number three, prostate enlargement or bladder cancer. Prostate enlargement is more common in men because it's men that have prostate glands. It helps to liquefy the sperm cells and all that. Many of what we'll go into in details in another video. But then bladder cancer, it's spread out. Men, women, anybody. So what happens? All of them are similar in the way that they cause problem. For instance, when this gland called prostate is enlarging, it presses everything. It presses the bladder, it presses the urethra, it presses the rectum. Everything is like a presser. So anything that comes close to it, it's pressing it as it's enlarging, it's pressing. Just think about it like when you're in a bus with some, sitting beside you. Anytime they turn, you'll feel it. And as it's enlarging like that, it's stretching the blood vessels in them, making them very brittle that any little thing can just damage them and blood will leak out. For bladder cancer, as the cells are multiplying, remember in cancer, the cells are multiplying rapidly than the body can contain. And this one also presses because the cells are multiplying and it's also pressing the surrounding structures. Remember also that there's strenuous exercise or workout. Yes, this one can cause it too. For those of you who will run from Lagos to Abuja, or who will work out the whole week without resting, this can affect you. This can cause blood to leak out in your urine, or this can cause urine to be bloody. If you are working out, your muscles are stretched, the tissues around them are stretched. These things can bruise your bladder. Your bladder can sustain injury through those strenuous exercise, and then those bruises can, make blood to appear because blood also come out from those bruises, and then you see that. Finally, which is number five, is kidney disease. Okay, calm down. We are not saying that your kidney has to fail before you have this. No, any inflammatory reactions within the kidney can cause those filters known as glomeruli to be damaged. And so these glomeruli, their work is to filter out things that should be in the bloodstream and remove those ones that your body don't need. So if you get them damaged or if they get damaged, whatever it is, either through any means, they may not be able to do their job so well, and then blood will pop out. So one interesting thing here is it's not just about blood appearing in your urine. There are some other symptoms that your body can use to validate what is already telling you in case you're in doubt. And one of them is frequent urination. Within a few minutes, you're in the toilet, another second, you are there again. Few things can make the bladder to become that way. Things like infection, things like prostate enlargement, and other inflammatory reactions around outside. So bladder is meant to gather all the urine that is released, that is formed in your kidney until a certain level before it tells you to go and empty them so that you don't live inside the restroom. And so, but when this pepper body starts, It means any little thing, it tells you, I want to go. Another little thing tells you, I want to go. This might be a way of your body telling you you have infection or there's another thing happening around outside. So you should go and check out, especially if there's blood in that urine. Secondly, it can also be telling you through painful urination. You go to the toilet because you feel pressed. You want to pee, something is not coming out. You wait, another pain, because the cells around those places, the nerve cells are already sensitive. The third one, lower abdominal pain or lower back pain. If you have kidney stone, you may be going through this. If you have bladder infection, this might be what you are experiencing. That's a sign that you should see your doctor as soon as possible. Yes, we understand that seeing blood in your urine can be worrisome. Yes. But panicking cannot solve the problem. Why not rush to the nearest clinic and get yourself tested to find out which of these things we've mentioned is causing it? There's just a very thin line between early detection of your problem and proper management. I remember this could be the game changer in all you need to have a healthy urinary tract and also to have a healthy life. So, if you have any questions, drop it at the comment section. If you have any place you want us to talk about more, drop it there. If you have any more clarifications you want to be made, thank you so much for the meantime. See you next.